Good evening, Miss Renu. So thank you so much for taking the time to participate in this interview session for today. So my name is Carmen.
Okay, then my name is Chen Jia Wen. I'm the second interviewer.
So we will be your interviewer for today's interview session. So it's a pleasure to meet you today. So we would like to ask you a few questions to gain a better understanding of your experience as an occupational therapist. So without further ado, to begin with, could you briefly introduce yourself?
Okay, so my name is Renuka. So I finished Bachelor in Occupational Therapy. Then I completed my master's in Family and Child Psychology. I'm working with special needs children for nearly 10 years. Oh, sorry, nearly 12 years already now. And so I'm also a tutor. So I'm teaching for syllabus for special needs education. And then I'm also a director of a center, a co-director. So I have a center which has EIP, OT, and ST in Bainapas. And I think, is that enough? Do you need more information? Yeah? Okay.
Then, so could you willing to share some of the experience as an occupational therapist?
Okay. It's been around 10 years, right? I'm in this field. And initially, I was not thinking about joining the pediatric setting. So I was more onto like geriatric when I was studying, and then the job opportunities towards pediatric is much more compared to any other field. So when I got the job, I learned a lot through my clients and whatever I had in my theory. And then from there, I actually pick up like how to work with the children, how to make sure we want to maximize their independence, how to actually engage with them, so how to improve their skills and all those things. So yeah, it's a very nice journey, and it's also like uh, every day would be a different day because you would see different kids in your work. Yeah, that's my experience.
So thank you for sharing that. It's really interesting to hear about your background. Okay.
Miss Renu, can you tell us like what kind of thing that inspire you to become an occupational therapist? Is that influenced by your family friends, or is that really your ambition?
No, it was not my ambition. So initially, actually, for my diploma, right, I studied diploma in medical imaging. So something where I work with machines, and then we do like X-rays, ultrasounds, we learn all those things. So my diploma was there, and then I feel like I need my personality, I need to work more with people. I want to engage more with people. I feel like I can help people. So I want my days to be different every day. So when I was doing my diploma, that time I didn't know there's a course named occupational therapy at all. And I know there's a physio, there's pharmacy. Of course, I want the main reason is like why I'm going for medical imaging or OT, because I want to go to medical field, something related to healthcare. So I did my diploma in medical imaging, and then while I was doing it, that's the best thing I can choose that time. And then while I was doing it, I saw my classmates, like sorry, my roommates who are occupational therapy, who are learning occupational therapy, and that's where I learned about occupational therapy. So when I choose to do my degree, I choose this course where I do the transfer credit, and then I do the lateral entry, and that is the reason. So main reason would be like I want to work with people. I want to try to make changes in their life.
Wow. It's such a very talented and also very heartwarming work.
Thank you.
So may I ask like how many years you have been practicing in this field and what areas you currently are specialized?
Okay. I graduated in 2024, so now it's 2026. So I've been in this field for 12 years now. And once I graduated from my degree, I was working for I think 4 years, and then I went to UK to continue my study in family and child psychology. and then I come back, I continue working as a pediatric occupational therapist. Okay, the reason I choose pediatric is because I that is the demand. The demand is very high, and I'm naturally good with kids. So that is the reason. And why I further my study in family and child psychology is because I feel like being an OT, I feel like my knowledge is not enough. So I need to go and learn more on psychology. That's why I got that in my master's. I pursued something related to that for my master's. So it has been nearly 12 years experience, and my specialized is in pediatrics.
That sounds very exciting.
Then, in your whole daily like working as a occupational therapist, what are those main roles and also responsibility in your daily working day?
As an occupational therapist, so we do one-to-one sessions. So the kid come to us is like more to one-to-one. So it's a hourly sessions. So like I have 9 to 10 one session, 10 to 11 one session. So once they came, if there's a new case, then we will do an assessment. And after the assessment, we will plan the goal, short term, long term. And then we'll set a goal, and then we will plan the intervention for the client. So this is one of the job that we do. And usually, so after the assessment, we'll go for the weekly therapy. So every week we do some activities related for their goals. And then once we are done with the goals, we are done with the activities, we will check whether the goals are achieved or not. And then if it's achieved, then we proceed with another goal. If it's not, then we'll work another way. So that's what we are doing as a daily basis. Other than that, since I'm working with early intervention, I'm working in early intervention program. So I work very closely with teachers, special need teachers. So I do discuss with them on like what can be done in the classroom environment. And for early intervention program is it's like a kindergarten for children with special needs. So they come daily, they get interventions like related to academic. If they have motor skills issues, then teacher will work on motor skill issues. If the kid has issues in like behavior, then the teacher will work on it. So that's how early intervention works. It's something like they come at 8:30 and then leave at 12, like something like kindergarten, but it's not directly. So early intervention program, they have like 3 to 4 kids, one teacher. And I do discuss with them in planning their individualized education plan. So this one is specifically for special needs children. We do this. So the teacher and me and with the speech therapy, 3 of us will be sitting and discussing on like what kind of individualized education plan should be put for the particular student. So this is another scope for my job, my current job. 2. And then number 3, I also do give a lot of sharing sessions. I go to schools. Like yesterday, I went to like, if you know, Christy KDU, it's an international school. I went there to give a talk for the teachers. So I do a lot of sharings for teachers so that they can actually know a little bit on how to manage kids with behavior, kids with sensitive issues in their classroom. And then also I do like screening. We do pre-screening sessions. So we go to kindergartens and then we do pre-screening. So while doing the screening, we will know if the child has any difficulties. So maybe the teacher has concern, hey, why these children is like cannot sit still at all. So when we do screening, we got to know like, oh, the child has this issue. So we have to work on that. So yeah, this is the 4 main thing that we do. We also do a lot of talking to parents, like to work on activities that they can do at home. Yeah.
But
Okay.
I think this profession is a profession that requires a lot of love and a strong sense of responsibility, right?
Yeah. A lot.
actually-
Like you have to be very responsible because you always like you have more than 20 kids in your hand. Like you are a therapist for more than 20 kids, and you have to remember each of them. So you have to like make sure you're responsible for each of them and try to give them suggestions and things. Yeah.
Right, patient to like handle those children like that.
Yeah. Sometimes I do lose my patient, but then most of the time I try to maximize my patient as much as possible. because the kids they don't really understand us also sometimes, and then we have to try our best to understand.
Ah, so that's already helpful to know. Then, in your opinions, like what skills or qualities do you think that is the most important to become a good occupational therapist?
You need to have the patience and you have to have the passion. Both are important. So when you have the passion, you would want to know more. You want to do more. Like, what can I do better? What can I do better? So when you have the passion, you can do it. If you don't have the passion, it's a bit hard to work in this field because it can be very tiring. You have a lot of paperwork to settle. At the same time, you have to see the clients. So yeah, the passion is very important. Other than that, I think creativity is one of the important aspects for us to be an occupational therapy because we have to be creative in creating our activities. Since
Right.
especially when we are working with special needs children, then we have to be more creative, planning the task and thing. We cannot be like do like cycling, I just do cycling, not enough. So we have to find a different way to make them engage in it.
See, that's a great point. Thank you for sharing your perspective.
Welcome.
Okay, so based on your 10 years of work experience, can you share to us like some of the meaningful or memorable experience that you have experienced that with this kind of like variety types of condition of a patient?
Experience, right?
What is the most that you can't forget that?
Maybe I can share with you the child's improvement. Like I think that's one of the if it does connect with the question that you asked. So I have a kid where when he came to me, he was 2 plus. So when he came to me, he was drooling and he was crying for the whole 1 hour. And there's a lot of rejection, so he doesn't want to do anything. He was screaming, crying, and all the time. So I started very slow with him, with some play skills, and slowly like engage with him, more to client-centered approach. So when we were talking, like when I was talking with the parents. The boy is diagnosed with autism, and then the parents are very concerned about he might not be able to go to mainstream environment because of his condition. He's 2 plus at the time, so he was that year is 3. And then I was like, I'm also curious whether I'm also doubting whether he can go to the mainstream environment or not, because every parents want their children to go mainstream. They don't want, if possible, they don't want to go to special need environment. They want the child to be in a mainstream environment. So yeah, so and I was trying my best, and I was giving up at one point because it's getting too much. Like the boy is crying all the time, he was rejecting me and things. At one point, I tried to change my approach, like trying to involve the parents inside the therapy and planning some activities for them to do at home and things. So as my activities going on and on, so the boy improved very, very well. And now he's actually 7 and he's going to mainstream normal school, like mainstream school. So I think that would be my best memory that I have throughout like the whole journey. Like because he came to me when he was 3, now he's 7, so 4 years journey. And this is one of the cases. So we have so many different cases like this.
Wow.
I don't know if okay or not this answer.
It's very, very good answer,
Okay.
Miss Renu, because you did a very great job, especially
Yeah.
to this
Oh, thank you.
Okay, so like, could you share like how you usually to communicate and collaborate with the others healthcare professionals such as like physiotherapists, speech therapists, and so on, doctors, nurse, and so on like that?
Healthcare so far, physio is the okay, physio is second, I think. The first would be sorry, third maybe. The first is like speech therapy. We do communicate a lot with the speech therapy. And then second is the clinical psychology or development pediatrician. They are the one who actually look into the diagnosis of ASD, ADHD and thing. And then third would be physiotherapy, because when we work with kids with physical issues, then we will actually contact the physiotherapy. Okay, for speech therapy, we have a lot of discussion in terms of okay, how do we do it? either with messages if the speech therapy is not there, message, or we will send a letter on like what kind of goals and things to the speech therapy if they are not in the center. Either that or we can call and talk to them. So how we discuss is like I would ask like what are the issues the teachers the speech therapy is facing during her session regarding behavior, regarding body posture, regarding the sitting tolerance and things. And then they will give me a feedback and I will ask them in my session, how can I can engage with my kid or I can communicate with my kid better. So they would give me some suggestions that I can do in my sessions. So that's how our communication would be. And for development pediatrician, usually it's a report based. So we will provide a report for the development pediatrician and to tell that this is the goals that we are doing for the kid, for the client. And the pediatrician would not directly reply us, but then they will tell the parents like whatever we do is just nice, or they would suggest us differently. Maybe that time we were focusing more on gross motor skills. So the doctor will be like, I think maybe you can change, you can work a little bit more on fine motor skills too. So I'm just giving an example, but something like this. And then for physio, I would ask about more to like postural stability, like what kind of activities I can do, whether what I'm doing might affect his posture or not, like because we do work a lot more on the core muscle strength and all the animal walks, all those things we are doing. So I will discuss with the physiotherapy if my activity is correct or not. And I also ask them suggestion whether I need to refer them to physio or not, especially for kids that has like flat foot or they have like a different posture in terms of legs. So they have their diagnosis is ASD, but then the way they walk, their gait might not be correct, might not be the usual gait. So usually I take a video with the permission of the parents, then I will actually talk to the physiotherapy. So they would give us a suggestion, what can we do, or they would ask for a referral letter so that I can refer the case.
Just give them like a gait training session like that.
Yeah, yes.
Okay. So now here comes to our last questions. Okay. So Miss Renu, what are the advices would you like give to all the students and all the people who are interested in becoming an occupational therapist?
Oh, okay. My advice, you already chose to become an OT is a big thing already because many people knows there's a profession called as occupational therapy. So it's like the awareness is very limited. So you already in the field is amazing. Good. Congratulations, because your demand is very high. It's getting higher and higher. Okay, and then second, I would say try to work a lot more on evidence-based approach. So try to look for evidence-based approach. Try to get the latest, try to read a lot of journals, the latest evidence that was provided. So look into news, look into journals, and make sure we as an occupational therapist, we are up to date with all the policies. Like, for example, now the new policy where a 6-year-old can go for standard one. So all this kind of policy, we have to be aware because we are working with children, right? So all the policies and evidence-based approach all try to be up to date once you graduated. And then if you have the passion to work with children, then choose to be a pediatric OT. If you don't have the passion, then there's a lot of other field that you can choose, like geriatric, we have physical, we have neurology, so psychiatric. So you can choose your field according to your passion. So, and then that would be my advice.
Okay, we will take note of all this.
Okay. So
Okay.
as a closing, thank you so much for your time for sharing with us your valuable insights for today. We really appreciate that
Okay.
your willingness to share your experience with us. It's also help us to increase our knowledge in this occupational therapist field. So okay, thank you so
Okay.
much for joining us for
Thank
today's
you.
session.
You're welcome. Thank you. Keep in touch. If you have any questions, you can get back to me.
Okay,
Okay,
sure.
thank you so much.
Then we later take
Thank
a
you.
call like that.
Bye.
Okay, sure.
Okay, take a
Bye.
Uh,